The treatments are going to depend on the acuteness of the disease. We're going to have in mild acute pancreatitis, of course, the patient is going to be admitted to the hospital, and we're going to have supportive care, including resuscitation with isotonic fluids like Ringer's lactate. We're going to have pain control, and we're going to have mobilization of the patient. The patient should receive a regular diet on admission. If not possible for nausea or vomiting, we're going to advance the diet from liquids to regular. And of course, this all is going to depend on the acuity, as I said at the beginning, because if the patient is a patient that is ambulatory, is mild pancreatitis, is going to have this horrific pain, and he's not going to feel like eating. He's going to need fluids because he's not going to be eating. And he won't need ICU status at the beginning. But most of these patients will need ICU status just because we want to be careful with them because they can deteriorate fast. Like when in severe acute pancreatitis, they're going to need enteral nutrition. And they're also going to have IV fluids, pain control, and we're going to be assessing on the cardiovascular. If they become hypotensive, we're going to have to give more fluids and sometimes pressors. If the renal clearing creatinine is good and renal function is good, then we're continuing the care with IV fluids. But if not, then we're going to have to get renal involved. In the respiratory system, the same. If we find the patient that he's having problems breathing because he's now septic, then now we have to give him support in that area. So we're going to treat accordingly to the symptoms of the patients. If the pancreatitis is caused by gallstones, then the patient needs a surgery. And if the patient is septic, they are going to need antibiotics, of course. And sometimes patients have extensive necrotizing pancreatitis and they show no signs of improvement and experience different complications. And we have to think about if our institution has what it needs to be managing these patients, like therapeutic endoscopy or radiology, because sometimes they need an ERCP or they need other procedures, and of course we're going to need an ICU unit. So if our hospital doesn't have an ICU, it has to be transferred to give appropriate care.